Welcome to the University of Tennessee Medical Center's shoulder replacement class. My name is April Humphrey. I am the clinical director here at the Advanced Orthopedic Center at UT Medical Center, and I'm going to be teaching you what you need to know about your upcoming shoulder replacement. Our goal for the Joint Replacement Center class is to help you prepare for surgery. We want to give you an overview of your hospital stay, help plan for your recovery, ease any anxieties that you may be experiencing, and answer any questions that you may have. Now remember, your joint is sick, but you are not. If you've ever been in the hospital before, this hospital stay might be a little bit different than what you have experienced previously. We like to get you up, we like to get you moving, and we like to get you home so that you can be on your way to a quick recovery. Now let's talk about some ways that you can prepare for your surgery. First, we're going to focus on your home. Have someone that is able to stay with you for the first week or so after your procedure. This is important because you will not be able to move around and do the things that you are doing right now. It'll be nice to have someone there as an extra set of hands to help you. Next, look at your home environment and remove any obstacles that could cause you to trip. The things that we see most often are rugs, pets, and cords. Next, pick an area in your home that is safe for you to rest and sleep. A lot of times we hear that patients are more comfortable after shoulder surgery sleeping in a recliner, and sometimes our patients sleep in recliners up to 2 to 6 weeks after surgery. You will also want to have ice packs available. You can go to your local pharmacy and buy ice packs, or next time you're at the grocery store, feel free to grab a bag of frozen peas. You will also want to place clean sheets on your bed before you come to the hospital, and have any type of assistive equipment that you think you might need after surgery. What else do you need to think about while you're preparing for surgery? Driving. You will not be driving after surgery until you are given permission by your surgeon. You need to think about somebody who might be able to help you run errands after surgery and also who will be able to help get you to your physical therapy appointments. Home medications. Make sure that you get refills on your home medications before you come to the hospital. You don't need to bring those to the hospital with you, but it will be nice to have them at home so that you don't run out. Meal planning. Make meals ahead of time and freeze them. Whenever you go to the grocery store, pick out your staples. Think about protein, leafy green vegetables, and fruit. Make sure that you're drinking 8-ounce glasses of water a day. Now let's talk about some other things that we do to prepare for surgery. All of our patients must go through a medical clearance process. This is done through PAT or pre-anesthesia testing. All patients must be evaluated in PAT prior to their surgery to make sure that you are as healthy as possible. You can expect in PAT that they will review your medical history. They're also going to look at your medications and tell you what to stop and when to stop taking it before surgery, and they'll complete any other tests that you need to have done before your surgery. When you're in PAT, they may tell you that there are other providers that you need to follow up with. Now let's talk about infection prevention. We use a benzoyl peroxide for preoperative skin preparation. This cream will be applied 5 times prior to your surgery. We will talk in the next slide about application of this product. We also give you antibiotics before, during, and after surgery. All of our patients also receive a 3M nasal antiseptic ointment. This is a cotton tip that is coated in povidone iodine and will be circled on the outside of your nose after you are asleep. It's important to know that this product may leave your nose a little bit orange tinged, meaning that you may have some orange color on your nose. This is just used to help decrease the colonization of Staph aureus and help decrease your risk of infection. It's also important for you to know that we use an alcohol-containing antiseptic in the preoperative area to make sure that we prep your skin appropriately. Now let's talk about how to use your benzoyl peroxide cream. You should have already received this cream from PAT or from your surgeon's office. If you have not received this cream, please call our office so that we are able to figure out the best way to get it to you. It's important that you use this cream prior to surgery to help prevent infections. You're going to start using this cream 2 days prior to surgery, twice a day, and then also the morning of surgery. This will be a total of 5 times that you will use the cream before you come for your surgery. We recommend that you apply a $half size amount of cream to your entire operative shoulder and to the armpit area after you bathe. We encourage you to bathe just as you normally would and put on clean clothes. Please note that this cream can cause some skin irritation or a mild rash. If you have a rash, please call our office to get direction on what to do from there. Most of the time we encourage patients to still use the product, but if your rash is severe, we do not want you to use the product. So if you experience some type of reaction to this product, please call your surgeon's office for direction. Also note that you should not use deodorant on the operative side after you start applying the cream. If you've ever had an allergic reaction to this type of cream, do not use this cream. Instead, just use an antibacterial soap. While we're talking about infection prevention, I would like to go ahead and talk about some things that you can do after surgery to help prevent infection. Make sure you wash your hands before and after changing your dressing. If you sing the happy birthday song, that should be about 20 seconds and that will help get your hands clean. Do not let your pets sit on your bandage or your incision. Make sure to place clean sheets on your bed before you come to the hospital, and make sure you keep your sheets clean often. We also encourage you not to allow your pets to sleep in the bed with you. You will want to use a clean towel and washcloth after each shower or sponge bath. Make sure you put on clean clothes, and make sure that you keep your incision clean and dry. Now let's talk about a list of things that you should not do prior to your surgery. We ask that you do not take your blood thinning medication starting 7 days before surgery. This information should have been reviewed with you at your pre-anesthesia testing appointment. If it was not, or if you have questions, please reach out to PAT to ask what medications you should stop taking and when you need to stop taking them prior to your surgery. We also ask that you do not wear any lotion, powder, or deodorant the day of surgery. What do you need to bring to the hospital? We ask that you remember that you are only going to be in the hospital for one night, so make sure that you pack comfortable, loose clothing. You will also want to bring shoes with closed heels. Any toiletries that you may need that are brand specific, you can bring those as well. We have your common toiletries here, but if you like a specific brand, we encourage you to bring that with you. We also encourage you to bring your CPAP if you have one at home. Make sure that you write down the settings for your CPAP, and keep in mind that you will now be required to sign a form saying it's safe to use your CPAP while in the hospital. We also ask that you bring your joint replacement guidebook with you when you come. Now let's talk about some things that you will need to do the night before surgery. Rest is one of the most important things that you can do. Having a good night's sleep prior to your procedure will be important and help you feel ready for your surgery the next day. Take your nightly medications that you were instructed to take by pre-anesthesia testing or PAT. You will also want to eat a good supper that night. We ask that you do not eat anything that is high in fats or that you do not eat a very large meal. You will also want to apply your benzoyl peroxide cream. We now have new instructions for when you should stop eating and drinking before surgery. Prior to these instructions, you may have always heard, do not eat or drink anything after midnight. I'm happy to tell you that we have changed that a little bit. You may now eat up until 8 hours before your requested arrival time. We ask that you avoid large meals or foods that are high in fat. You may also have clear liquids up until 2 hours before your arrival time. Here is an example of some of the clear liquids that you may have up to 2 hours before your requested arrival time. You may drink water, fruit juices without pulp, that includes apple juice, grape juice, and cranberry juice. You may have carbonated beverages. You can drink clear tea and black coffee, but do not put cream or sugar in your coffee. And you may also drink Powerade or Gatorade. Now let's talk about some things that you need to do the morning of surgery prior to coming to the hospital. You will want to make sure that you apply your benzoyl peroxide cream to your operative shoulder, just as you were instructed earlier in this video. You also want to take any medications that you were instructed to take by PAT, but only with a small sip of water. We ask that you do not bring valuables to the hospital with you. We also ask that you do not wear makeup, lotion, nail polish, contacts, or jewelry. When you arrive to the hospital the day of surgery, you can park in parking garage H. You will see that the H garage is outlined with the red arrow below. Please note that the hospital map is located in the back of your patient guidebook. We are currently not offering valet services, but if you need assistance, your family, friend, or loved one can drop you off at the entrance to the hospital. When you arrive to the hospital on the day of surgery, you will start your day in the registration office. Registration is located on the first floor. After registration, you will go to the pre-op area. In the pre-op area, they will remove your glasses, hearing aid, and dentures. Please make sure that you bring a case that is labeled or a bag that is labeled for the items above. While you're in pre-op, you'll get your antibiotics through your IV, and you will start the anesthesia process. We will also give you your 3M nasal antiseptic to help prevent infections. Please note, at this time, we are only allowing one family or friend in the hospital with each of our patients. When you have done all the things that you need to do in the pre-op area, your operating room nurse will come and escort you to the operating room. This is where your surgeon will do your procedure. After the operating room, you will be taken into the recovery room. This is where a nurse will be closely monitoring you while you recover from your anesthesia. After the recovery room, you will be taken to the joint replacement center. Please note, immediately after surgery, the surgeon will come and talk to your family or friend in the family waiting area. After the surgeon talks with your family or friend will be asked to leave the campus due to the current visitor restrictions related to COVID-19. When you arrive to the Joint Replacement Center, this is where you will start meeting your joint team. Your joint team consists of multiple people at the hospital. This includes your surgeon, your nurses, your nurse techs, occupational therapy, physical therapy, case management, and sometimes even a hospitalist. We want you to know that all of these people are working together to make sure that you get the best care possible. Now let's talk about ice therapy in the hospital. Ice therapy will be very important after your shoulder replacement surgery. Ice therapy can help decrease your pain. Anytime that you are having pain, you need to put ice on the site that hurts. Ask your nursing team for an ice pack. Please see the picture below for the types of ice packs that we use in the hospital after shoulder surgery. Now let's talk about your surgical bandage. After surgery, your surgeon will put a bandage on your shoulder. This bandage may be changed before you go home. All of our surgeons have instructions that are a little bit different on how to manage this bandage once you're at home, so please make sure that you follow your surgeon's instructions. If you have questions about this, please ask your nurse before leaving the hospital. Staying active after surgery. We will provide you with an incentive spirometer. An incentive spirometer is the device that is pictured on this slide. After surgery that involves anesthesia, it is good to exercise your lungs in order to prevent pneumonia and other residual fluids that may be in your lungs. The benefits of using your incentive spirometer are that they gently exercise the lungs to keep them as healthy as possible. They also increase lung capacity and improve patients' ability to breathe. Make sure that you continue to use this while you're at home for up to 2 weeks after surgery. The nursing staff on the Joint Replacement Center will show you how to use this device. It is important that you use this 10 times an hour while you are awake. Please don't be afraid to ask our staff for clear instructions if you're not sure how to use this. Falls after a joint replacement surgery are a really big deal, so we do several things in the hospital to prevent falls. You will be given a gait belt that you will wear every time a staff member gets you out of bed. This gait belt will help a staff member stabilize you if you start to fall. We also use bed and chair alarms in the hospital. We do not want you to get up without help, so make sure that you keep your call light close and call before you fall. Anytime you need assistance, please hit your call button and we will send a staff member to your room to help you get the things that you need. Never get up without a staff member present in your room. Pain control after joint replacement surgery is really important. The picture below, you will see the ruler that we use in the hospital that rates your pain on a 0 to 10 scale. It's important for you to understand that you will have pain after your surgery, and everyone's pain is just a little bit different. While we do try to use things that are effective for most patients, it's important for you to communicate with us if the pain medication that we're giving you is not working, or if it's too much and making you too sleepy. Now remember, one of the most important things that you can do for your pain is move. Motion is lotion. Pain is a part of the process, and unfortunately it is part of your healing. Make sure that you're communicating with your team if you feel like that your pain is not controlled. Most pain medication is ordered every 4 hours or as needed while you're in the hospital. You will need to call out and request for your pain medication. Make sure that you talk to your nurse about your pain management whenever you come to the Joint Replacement Center. Now let's talk about some things that you can do to prevent the risk of complications of surgery. One of the main complications that we see after surgery is constipation. Constipation can be caused by a wide variety of things. You're not up and moving like you normally would. Sometimes you can be a little bit dehydrated. Anesthesia tends to slow things down, including your bowels, that can make you a little bit constipated. We recommend that you take stool softeners, which will help soften your stool. Stool softeners are found over the counter in your local pharmacy, and they are often called Colace or Miralax. We also recommend that you take a laxative. A laxative helps push stool through your bowel. Laxatives include things like senna or magnesium citrate. Blood clots are another complication that we can sometimes see after joint replacement surgery. Things that we can do to help prevent blood clots are TED hose. You will see TED hose on your legs whenever you wake up from surgery. We also use compression devices, as you will see in the picture beside the slide. We also encourage you to move. The more you move, it keeps your blood flowing. We also encourage you to do the ankle pumps that are the exercises in your book. This will help keep blood flowing through your legs. And then all of our patients will be leaving the hospital on a blood thinner. Discharging from the hospital. The day after surgery, we will discharge you as soon as you are able to pass physical therapy and you are medically stable. Most patients are able to discharge from the hospital the day after surgery and often leave even before lunch. Upon discharge, you will be taken down in a wheelchair to the fountain circle. That is where your family or friend who is taking you home will meet you. We would like for you to know that we have an outpatient pharmacy here on campus. Our outpatient pharmacy is located across from the cafeteria. If you would like to have your prescriptions filled here, please tell your nurse. Your nurse can fax down your prescriptions and you can pick them up on your way out. Please note, if you are from a different state, you will likely not be able to get your pain medication prescriptions filled in your home state. Pain medication prescriptions must be filled in the state that they were written in.
Medication laws. The state of Tennessee has very strict laws that your surgeon must abide by when prescribing pain medication. There are restrictions on how much pain medication your surgeon can prescribe for you. These restrictions are determined by the state of Tennessee, your insurance company, and your pharmacy. They are not determined by your surgeon. Please discuss with your surgeon if you have any questions regarding your medication prescriptions.
Now I would like to talk to you about your toolbox for pain management. We use different things to help manage your pain. Some of the most common things that you will see are narcotics or pain pills like oxycodone, tramadol, hydrocodone, Dilaudid, or Nucynta. Sometimes we also prescribe nerve pain medication like Lyrica or gabapentin, nausea medication like Zofran, Phenergan, or Vistaril, but I would like for you to know that there are other ways that you can control your pain. This would include ice therapy and Tylenol. We do, however, ask that you do not take any anti-inflammatories until your surgeon instructs you to take those. Anti-inflammatories include things like Motrin and ibuprofen. Now we would like to talk about your pain medication prescriptions. Take your pain medication as prescribed but only as needed. An example is take every 6 hours as needed. This means to take your pain medication when you are hurting but no sooner than the hour written on your prescription. What can you do for breakthrough pain? An example, if you take a pain pill at 8 a.m. and can't take another one till 2 p.m., but you start to hurt during that time, this is called breakthrough pain. Some ways that you can manage your breakthrough pain are ice therapy, Tylenol, and some physicians will write orders for medications for you to take for this breakthrough pain like Tramadol or Vistaril. We would like to encourage you to stay ahead of your pain. If you rate your pain a 4 through a 6, then it's probably time for you to take something before your pain gets out of control. You do not have to set an alarm to wake yourself up in the middle of the night to take pain medication. If you are sleeping, then your pain is likely under control. When is it time to start weaning your pain medication? If your pain is a 1 through a 3, then it's likely time for you to start weaning your pain medication or your narcotics. Some ways that you can do that are starting to spread the time out between taking pain pills, cutting your pain pills in half, start replacing pain pills with Tylenol. We do not encourage you to stop taking your pain pills cold turkey, meaning stopping them completely, and we also encourage you to use ice therapy. Now let's talk about the sling that you will have after surgery. You will need to wear a sling after surgery. Your doctor will advise the length of time that you should wear this sling. We will teach you and your family how to put the sling on and how to take the sling off. Your surgeon will instruct you when you are able to stop wearing the sling. It is okay to use your hand for simple things such as typing, cell phones, or holding a newspaper while it's in the sling. We do, however, recommend that you do not lift over 1 pound in your operative hand. Another prescription that you will need is a physical therapy prescription. If you are going to outpatient physical therapy, be sure that you have a prescription for your therapy before you leave the hospital. You will need to take this prescription to your first therapy appointment. This prescription is needed in order to bill your insurance. What are some ways that you can optimize your recovery at home? The first and most important thing that you can do is make sure that you're getting plenty of rest. We also encourage you to be active while you're awake. Make sure you go on walks and continue to do your daily exercises. It's equally as important that you eat a healthy diet, leafy green vegetables, fruits, proteins, and make sure that you're drinking 8-ounce glasses of water a day unless you're on a fluid restriction. Some of the things or questions that we usually hear after surgery is sometimes patients feel a little bit depressed, meaning that they're sad or they're just not feeling like themselves, and that can be common after surgery. Make sure that you have visitors or family to talk to, and if this continues and you're concerned, talk to your primary care doctor about this. Another question that we get after surgery is, how long is my recovery? And the length of recovery is different for everyone. It can take 6 months up to a year before you are fully recovered after a joint replacement surgery. Follow up with your surgeon after surgery is very important. Most surgeons like to follow up with their patients at 2 weeks, 6 weeks, 3 months, and 6 months. At the 2-week appointment, they will be checking to make sure your incision looks good and that your staples are removed. After the 2-week follow-up, the 6-week, the 3-month, and the 6-month appointment are equally as important to keep because your surgeon is just going to be making sure that you're recovering well. Now I would like to talk to you about some changes that we have had to make to our program and to our hospital related to COVID-19 or coronavirus. Whenever you enter our campus, when you come in through the door, we have checkpoints. At this checkpoint, you can expect that someone will be assessing you to see if you have traveled within the last 2 weeks, and they will also be taking your temperature. This is the checkpoint where they will also verify that you have one visitor with you. You may also notice that most of our staff will be in masks while you're here. This is for the protection of our patients and also for our team members. We are also enforcing a no visitation policy right now. What that means for you and your family is that you will only be able to have one person with you while you are going through your surgery. After your surgery, your surgeon will come out and speak to that one person that will be in the surgery waiting lounge. After the surgeon speaks with that one person, they will be asked to leave the campus. They will not be allowed back onto campus until you are discharged. We also encourage that if you live far away that you look into local hotels for your friend or family to stay the night so that they are able to come and get you the next day after surgery. Our goal at the University of Tennessee Medical Center is to always deliver excellent service at every step of your total joint replacement journey. We want your experience to be nothing but the best. You may receive a survey in the mail after your hospital stay. Our goal is that you are able to rate your experience with us a 9 or a 10. Now, if you feel like at any point during your journey with us that we haven't quite met the mark, please reach out and let us know. Our goal first would be to recover, and then second, to make sure that we are able to correct any problems or difficulties that you may experience. Again, we don't anticipate anything but the best, but please let us know if there's something that we can do for you. Lastly, we would just like to thank you. Thank you for choosing the University of Tennessee Medical Center. We know that you could choose any other hospital in Knoxville, but we thank you for choosing us. Our hope is that you would be able to recommend us to your family and friends. I want you to know that we are here for you. Although we are typically able to provide this joint replacement class in person, due to our circumstances right now, we are not able to gather together. but we want you to know that we still have resources here for you. So if you've listened to this presentation and you have any questions, please do not hesitate to give our patient navigator a phone call. We're happy to help navigate you through the process of your total joint replacement. You can reach us at 865-305-3270. Thank you.